Hey parents, have you ever had to deal with an irritable child in the morning? Or have you noticed your child snoring, mouth breathing, tossing and turning? Have they been having trouble focusing at school, kind of getting in trouble for being too fidgety? Well, did it ever occur to you that it could be related to the mouth? Hi, I'm Courtney Atkinson, and I'm the myofunctional therapist at McMurphy Pediatric Dentistry in Biloxi and Ocean Springs. So what is myofunctional therapy? It's just retraining the muscles of the orofacial complex, so the face, the mouth, to work in harmony. So many times kids who have tongue ties or have just never used their muscles appropriately will start to use multiple muscles to move one muscle. So then we get fatigue, we get overdevelopment, we can get the TMJ issues, the popping, the clicking. So these are all the important things that we look out for. We start with a myofunctional functionality assessment. I start with the outside of the body and I work my way in, talking with the parents, taking measurements, taking pictures, screening the children to see if it's the tongue, to see if it's tonsils, see what's going on that may be causing the dysfunction. And then I come up with a customized treatment plan, phases of therapy, and possible frenectomy if Dr. Austin thinks it's appropriate. So a frenectomy is where the doctor removes the fascia, the tissue under the tongue, or the lip, the restrictive tissue, which is fascia. The theme of my myofunctional therapy program is a superhero theme, and I really feel like this generation of kids are superheroes because they're tackling these airway issues head on. And we know airway issues have been linked to developmental issues, behavioral issues, sleeping issues, and it's not an easy thing to work on, but they are coming in here and they're trying to change their lives, and in turn they're changing their parents' lives, who are then starting to think about what they're doing and what they could be doing better, and it's just going to be a rippling effect. And who knows, maybe in 10-15 years we won't have the ADHD issues anymore, we won't have the needing the melatonin or Tylenol PM to help us sleep, and we're starting with this generation of superheroes to get us there. So our myofunctional therapy functionality assessment usually takes me between an hour and an hour and a half. So this video is going to show you an abridged version of that assessment, just to kind of give you an idea of how we do that assessment. We use photography, videography, just to develop a baseline of where your child is now. So let's get started. Hey, I'm Miss Courtney. I'm the myofunctional therapist here at McMurphy Pediatric Dentistry.
Hey, I'm Kelly.
Kelly, nice to meet you. Hey, Ben. It's so nice to meet you. I was looking over your paperwork and I'm so excited to get to see what's going on today because I heard that you're having trouble sleeping at night. Is that true?
Tossing and turning, grinding.
Do you snore, Ben?
He does snore.
Does Mama have to kick you out of the bed at night because you're snoring, waking her up? Yeah. Well, we will definitely explore that further, okay? So, Mom, what I like to do, I like to just start with the outside in because snoring, teeth grinding could be related to a tongue tie.
Okay.
If the tongue is tied, there's a chance it could be tight and uncomfortable in other areas. So I always like to get them in front of the chart and look at the whole posture, okay? So we'll get started over there. Ben, can you come stand in front of my chart for me? And I'm going to be taking a lot of pictures today, okay? So what I want you to do, I want you to stand right here, just like you normally would. You don't have to smile. So I like to look at the ears. The ears are really good at telling us if there is anything that's out of whack here. If one side's higher than the other, then that's something we need to explore further. So we'll get front and side. Perfect. Good job, Ben. Okay, Ben, then you can come have a seat over here. So tell me, Ben, do you know how to blow your nose? Do you? Is that something you can demonstrate for me today? Always like to start with simple solutions. So if they're mouth breathing, sometimes the reason they're mouth breathing is because their nose is congested. And some kids just aren't capable of clearing that out. So we like to rule out the simple solutions before we jump to anything drastic.
Okay.
So I like them to demonstrate that nose blowing for me. Can you blow your nose for me? Ooh, good. Now, Ben, when you're blowing, can you plug one side and blow really hard through the open side? Oh, now plug the other side and do that same thing. Good, thank you. You can put that right here. And then here's some hand sanitizer. Does that help? Do you feel like you can breathe better? Or still very congested? Yeah, here in South Mississippi, something is always blooming. So
Yes, it is.
seasonal allergies. But a lot of times that can be cleared up or helped with over-the-counter allergy medications. I always encourage you to, talk with a pediatrician, see what they think about that chronic congestion, if it's something that he deals with year-round.
Okay.
Ben, I'm going to get a picture of your nose, a very silly picture, okay? So can you look up at that yellow ball for me? What I'm looking for, Mom, I'm looking to see if the nostrils are symmetrical. I'm also looking to see if there's debris in both nostrils or one versus the other.
Okay.
Good job. So I'm going to have a bright light with my phone, okay? Perfect. And Ben, I promise I do not share these pictures with anyone, so no one's going to see your nose pictures. So they're looking very symmetrical. I'm not seeing a whole lot of debris, but I like to explore the nose further. All right. So what I want to do, I want you to just breathe in and out through your nose for me. Good. One more time. Okay. Now I'm going to gently push on this side. Can you breathe in and out through your nose? Good. Do you feel like you got a lot of air through that nostril, or was it kind of hard to breathe? You're doing my job for me. That was what I was going to do next. Do they both feel like you can breathe easily?
This one better.
You can breathe better through your right nostril. Okay. Now breathe in and out. Did that help you breathe better through your left nostril, or did it make it harder? Did that help when I pushed out? So I tried to simulate, you can think of like a breathe right strip, which will open your nasal passages. So I try to do that with my finger for kids who feel like there's one side that they can't breathe as good out of. Mm-hmm. If that helps them, that could tell us that maybe the adenoids are swollen, maybe there's something obstructing the airway. So that's something we'll definitely keep an eye on and possibly need an ENT referral or something like that, because that did help them out. It opened up something. So something is obstructing up there possibly. So that's something we'll definitely keep an eye on. So now I'm done with your nose. I'm going to start with your jaw, your cheeks. I'm going to check all these muscles, okay? If we're grinding, that puts a lot of pressure on, you know what these little joints are called? Our TMJs, that opens and closes our jaw. If we're grinding at night, clenching our teeth, that puts a lot of pressure on those little joints and can cause some discomfort, popping, clicking. So I'm just going to gently touch around there, okay? And I'm going to have you open and close. I'm just going to feel first. Now can you open slowly and close? Good. Do you feel any discomfort when you open or close? Try one more time. Open and close. What? Did that hurt? Okay, on the right side. And I could feel some kind of slipping on that side too. Now what I want you to do, we have little muscles in our cheeks. They're called masseter muscles. And they are muscles that help us eat, chew. But in people who clench and grind, they can be really developed. So I want you to clench your teeth together like you're really mad. And relax. Clench and relax. Good. I could feel a little bit of development. They did not feel overly developed for his age, but I could definitely feel them. Now I'm going to take some pictures of inside your mouth, okay?
Could that have to do with the grinding?
Mm-hmm. Yes. So kids who grind their teeth, you can think of someone who works out in the gym. They're going to have way bigger biceps than someone like me that I have. So a kid who grinds, clenches all night, and they've done it for years, their muscles are going to be very overdeveloped, more overdeveloped than what would be age appropriate. Okay. His, I don't see them I don't visually see them when he contracts those muscles, and I could feel them, but they weren't bulging, they weren't huge. So it is something I will note. Right. And I'm about to look inside to see how much wear there is on the teeth. And then that will tell us a lot about the grinding and what damage has been done. Okay, so what I want you to do first, I have these little cheek retractors, and these are just going to pull your lips and cheeks back so I can really see those teeth, okay? Okay, so I don't want them behind your teeth. Good job. Perfect. And can you bite? Just your normal bite. Good. So I'm looking at the wear, but I'm also just looking at his overall bite. Good. Just keep biting. Good. Of course, tongue and other muscle dysfunction can lead to malocclusions, such as overjet with the teeth, where the front teeth stick out further than they should if that tongue is resting against them. And Ben in particular, he definitely has what appears to be a lip tie there. Okay. And that could be contributing to that diastema, that space between his teeth. So that's something that Dr. Austin would want to look at to see if that tissue needs to be released to help close that space in the future. Good. I'm going to put on a glove and I'm just going to, you're doing good. You don't have to use those anymore. I'm going to look at your bottom lip. I always look for any kind of tied tissue. As a myofunctional therapist, I don't diagnose tongue ties or lip ties, but it's something I do like to look for. And that way I can alert Dr. Austin if I feel like, you know, he needs you to explore further about some of these areas that appear to be tight or restrictive. Okay. Now what I want you to do, I want you to open and lift your tongue up. Can you put your feet down for me? Thank you. And kind of sit up nice and tall. Good. Oh, that's good suction. Wow. So Mom, if you want to come look, he has what we call an Eiffel Tower appearance on this frenum. You can see how it webs out at the bottom there. It's blanched, which is a sign that it's tight. But also, do you see these little circular things hanging off the side? Those are his salivary glands, and those are supposed to be way down there. But because of how tight it is, to be able to raise his tongue up, he's pulling the floor of the mouth up, and in turn pulling those salivary glands up.
So those right here are supposed to be down.
Yes.
Oh, okay.
Mm-hmm.
Okay.
So
wow.
Yes, he can raise his tongue, but to do that, he's compensating by taking the whole floor of the mouth with him. The tongue is supposed to be able to move freely away from the floor of the mouth. So that's a sign that we need to get Dr. Austin, you know, to get eyes on him, to look at that tissue there and that lip that we talked about. Okay. You can see that lip is very webbed there.
Yes.
And he has that what we call diastema, or a space between his front two teeth. Sometimes that lip tie can actually cause a divide in the bone itself, and that can keep that space there, even after orthodontics. Orthodontics could close it, but as long as there's that space in the bone there, there's a chance that he's going to relapse.
So if this isn't fixed, the ortho still may not
help. It may help temporarily, but if that bone is still divided like that, it's more than likely going to pop back open. We've seen that happen.
Okay.
Mm-hmm.
Okay.
Ben, you're doing a wonderful job. What I want to do now, I want to get you to do some silly things with your tongue, okay? What I like to do, Mom, I like to see...
Sorry.
It's okay, Ben. I like to see if the tongue tie is impeding function. We don't ever like to diagnose a tongue tie just based on how it looks, because we've seen kids that it was very tight, almost to the front of the tongue, but they really had no functional issues. Okay. So we always like to look and see if it's actually impeding anything. Okay. So what I'll be looking for, I'm going to look to see if he can move his tongue nice and easy without having to use his jaw or close the mouth excessively, just basically to make sure there's no compensations that are helping him move his tongue. Okay. Again, the tongue should be able to move all by itself. Okay. All right, Ben, I'm glad you're having fun, but we don't need these anymore, okay? So I saw you were doing that suction earlier. Can you try to hold that for me so I can get a really good picture? Good. So good. Try to hold it. Good. So I'm looking to see if the tongue can fit comfortably in the palate. If the tongue hangs over onto the teeth at all, we consider the palate to be narrow or not wide enough to fit his tongue comfortably. So that's kind of how we judge if a child has a narrow palate. He does have, his tongue does hang over the back teeth slightly, so we would consider him slightly narrow.
So what would you do about that?
Well, it depends. So in his case, he has some space here, obviously. The teeth aren't overlapping. So for him, getting him to be able to contract the tongue muscles to make the tongue skinny and then try to hold it up, that could solve the problem without having to do something like an expander.
Okay.
So
The palate expander. I don't like it.
so a palatal expand.
exercises.
Yes,
Okay.
yes.
Okay.
Like I said, we always try to start out simple. Sometimes we do have to intervene though with other things.
Okay.
It's so important though that the tongue fit in the palate comfortably, because that is the ideal rest posture for keeping that airway open and for development. If the tongue is suctioned up there, it keeps the palate from becoming too vaulted, too narrow. If the palate continues to vault, it closes off the nasal cavities, because of course the palate is the floor of the nasal cavity. So if that tongue is not in suction, keeping it where it's supposed to be, it'll just continue to get more vaulted. So that's why we really want that tongue to live up there all the time. So I'm going to scoot around here and we'll get started with some exercises. All right, I have this mirror for you that you can use. What I want you to do first, try to sit up nice and tall while you're doing this. Overall body posture is so important for everything to work effectively, okay? What I would like you to do first, nope, I'm glad you're so excited, but not yet. I want you to just take the tip of your tongue and put it right behind your top front teeth. You should feel like a little ball of tissue back there. Let me point it out for you. Open. Right back there. It tickles a little bit. Good. That is the spot. That is like home base for your tongue, okay?
Mm-hmm.
The tip of the tongue should be touching that spot all the time. So not pushing on the teeth, but just behind the teeth. So I'm going to take a quick picture of your tongue up to that spot. Mom, we take a lot of pictures because we like to get a good baseline. That way we can track progress as he develops. Okay, so open big and raise that tongue to the spot. And I'm going to take a quick picture. So his tongue is folding instead of him being able to just get it straight up there. That's common if the tongue, hasn't been working like it should. Maybe all the muscles aren't developed like they should be. So it's kind of just floppy and foldy instead of nice and straight and strong. That's something that I'll definitely make a note of and something that we'll need to work on. It can also be a sign of hypermobility. Maybe it's just extra bendy. So if he is hypermobile in other places, that also reinforces the tongue could be hypermobile.
Okay.
Which just, we have to do a little bit of extra stuff in therapy to counteract that. Okay, so now, since your tongue was up there so beautifully, can you lower it down behind the bottom teeth for me? So we're just going to go up. Watch Miss Courtney. We're going to go up and down. Up and down. Good. Try to open a little bit bigger. Not enough that it hurts you, because I know that jaw was hurting a little bit. So let's be careful. Up and down. What I'm looking for, Mom, I'm looking to see if he's straining anywhere, if anything is tight or tense. I'm looking at these neck muscles to see if he's utilizing any of that to stretch that tongue up, or if he's having to close his jaw to get his tongue up. So one more time then. And down. Up and down. And down. Up. Yeah, we see he's having to close his jaw just a little bit. That just, again, I would expect that with how tight his frenum appeared. Now, can you go side to side for me? Look at Mom while you do that. I want her to watch your jaw. See how he's swinging? Oh, now he's fixing it. Good. Can you do that without moving your jaw?
Yeah, I saw the first time that his chin was moving.
Yes, good. Side to side. Good. Good, correct. You're still having a little bit of movement. Again, it's just when it's very tight, in order to move, the body is going to find a way. Where there's a will, there's a way. So in a lot of cases, if the tongue is tight, we're going to use that jaw to help move the tongue, which, what does that cause? It causes exhaustion. So lateralization, that side to side, is so important for chewing. We have to move the food around the mouth. So kids who maybe they don't finish their food, or they say they're full, but then they're hungry 30 minutes later, they're probably just tired because they're using so many extra muscles. That jaw is swinging. They're probably using their cheeks instead of the tongue moving efficiently.
Okay.
So that is something that we see a lot, but something that we definitely need to address.
That could be food textures also?
Oh yeah.
Okay.
If the food cannot confidently, if the tongue cannot confidently move the food around, the kids will learn like, well, I can't really handle that. So I'm just going to avoid anything that is in that realm. So then they get deemed a picky eater. Yep. Choking, gagging.
I see the little ball.
You see it? Uh-huh. The spot. Or it's called the incisive papilla, but Miss Courtney calls it the spot because it's easier for you to remember, huh? Now, the next one I want you to do, can you sit up straight again for me? So we did our up and down. We did side to side. Now, I want you to think of a lizard, a snake, or a frog. I want you to try to stick your tongue straight out and pull it right back in, but with your mouth wide open. Go kind of slow. I know frogs and stuff, they go faster, but so out and right back in. Out, straight out, like you're trying to aim for my finger and pull it right back in. But keep your mouth big and open. Straight out and right back in. Don't close. Straight out and right back in. See if you can come straight out instead of dropping your tongue down. Up here, raise it up. See how he's trying to use his teeth to push that tongue up.
To direct it.
Uh-huh. Again, that could be related to the tight frenum. It could just be related to he just has never tried to lift it, so he doesn't know how. But myofunctional therapy addresses the muscle development, muscle activation, things like that. It's all about body awareness. So he's going to be thinking a lot like, oh, where's my tongue at right now? What is my tongue doing?
I tried to feel my tongue with my tongue once.
You tried to fill your tongue with your tongue? How did that go? That's a very interesting. Now, I want to see if you can make a nice skinny tongue for me. So think of like a lazy puppy dog. And now I want you to see if you can raise it up. Yes, good. Try again. Skinny. No, without your lips. So do your puppy dog tongue. Now just raise the tongue up and make it nice and skinny. You did, but your lips helped a little bit. So we'll have to work on that, getting that tongue to move without anything helping it, okay? Now, what I want to see is a tongue bowl. Oh, that's a taco. That was a good taco. A bowl is where we pull up all the sides. Almost, yeah. But let's try to keep our lips relaxed. Let's reset. Let's shake it out. Nope, keep those lips relaxed. And only your tongue. Focus on your tongue. So let's sit up a little bit. Nice and tall and open. Get those lips out of the way. Nope, don't squeeze your lips. Okay, now stick your tongue out and try to curl the sides of the tongue up like a bowl. No lips. This can be so frustrating for kids because they're like, I'm not trying to move my lips. They are just doing it. Almost. You almost got it. You're so close. I want you to try to make that bowl. And then pull that bowl right back into the mouth. Almost. You're doing so good. You can see, Mom, that frenum appears to be inserting way more anteriorly than it appeared at first. Can you see that separation right there? It looks like he has a band of tissue that's actually inserting into the tip of the tongue to give it almost like that heart-shaped appearance. Okay. Even though when he first raised it up, it looked like it was inserting more to the mid-tongue instead of that anterior. Ben, you're doing a wonderful job, Ben. Can you raise your tongue up just like this? In the mouth, like, like that, but open a little bit. I'm going to try to get, oh, yes, like that. Open. Don't hide your tongue behind your teeth. Open. I want to try to get a good... Can you be still, Ben? Are you able to be still? Is it hard for you to be still with your tongue? Just try to raise it up. Or stick it out down your chin like your puppy dog tongue. That's a good puppy dog tongue. How far out can you stick it? Ooh, good extension. And the extension can be misleading. We've seen kids who are tied to the very tip of their tongue, can't raise it up a millimeter, but can extend it for days, it seems like. So a lot of times parents or even other clinicians will say, well, they can stick it out, so what's the problem? Right. But we want the elevation. Remember, for airway, we want their tongue to be able to comfortably sit at the palate. Okay. Extension is great, but we're worried about elevation. So, for him, again, he can elevate the tongue. He's just using a whole lot of extra stuff to get there. Right. And it's not a comfortable elevation. We can tell because he has to close his jaw. He's pulling everything up. So more than likely, the tongue is not going to just choose to go up there on its own. And our goal is muscle memory. We do these exercises. We get him aware of where his tongue is. But if it's not comfortable, it's probably not just going to go there on its own.
So
Ben.
exercises at home.
Mm-hmm. Ben, you're doing so good. The last thing I want to check is your lips. Okay. So we want the lips to comfortably stay sealed during the day so you can breathe through your nose. So we need nice strong lips that can stay together, okay? So this is a really fun measurement tool. I'm going to see how strong your lips are. Do you have superhero lips? Let's see how big your lip muscles are. So this goes behind the lips, not behind the teeth. So we're not going to pull any teeth out. Behind the lips, in front of the teeth. And then Ben, what I want you to do, can you sit up for me nice and tall? I want you to push your lips together like a kissy face. Yes. And I'm going to gently pull, and you try to hold that in just with your lips. Are you ready? 1, 2. Okay, get your giggles out. Ready? 1, 2, 3. Ooh, that was a good one.
I'm gonna do another one.
Okay, let's do it. So remember, behind your lips, smile just a little bit. Let me see, where's your button? Yep, perfect. Just making sure it wasn't behind your teeth. Okay, 1, 2, 3. Ooh, 2.5. Nice strong lips. 1, 2, 3. What happened with that one, silly goose? Mom, as he gets ready for this one, I want to show you something here. Look at Mom. Squeeze your lips. Do you see this bunching up and dimpling of the chin? That's the mentalis muscle, the chin muscle. So that can indicate another compensation like we've been talking about. So as he's trying to really squeeze these lips tight, he's actually utilizing this muscle as well. So this is something we'll work on, strengthening the lips without having to incorporate any unnecessary muscles. So that kind of the same thing we've been talking about with the tongue, just getting everything to move efficiently, independently, so we don't have to pull in anything unnecessarily. All right, you ready? 1, 2, 3. Oh, so good. Ben, you're a rock star today. I'm so proud of you. What are your thoughts? What was most frustrating for you? The bowl. Do you like using those? They're fun. So, Mom, what I like to do at this point, I like to type up the official report. I know, the water. I was going to check your swallow. So do we have enough water in there? Okay, so let me explain what I want you to do first. I want you to just put a little bit of water in there.
No swallow?
Well, yeah, but not yet. So just a little bit of water. I want you to try to smile and swallow. Good. So what I'm looking at, Mom, our tongue should be suctioned up or the water should be between the tongue and the palate. So when we swallow, we shouldn't see the tongue. When I watched him swallow, his tongue was pressed between the teeth, against the teeth. So it shows me he's not doing that proper suction swallow.
Okay.
So
I just swallowed it without my tongue right there.
You did. You're amazing, Ben. Better. You were so smart. You're catching on so quick. So chewing patterns, swallowing patterns, definitely something that we like to work on. We work on building strength, building control, but we also like that to translate into daily functions and activities. So if he's able to start moving the tongue independently, but he's still using the wrong muscles and wrong patterns when chewing, it's going to kind of counteract what we're trying to do in therapy. So that's definitely something we address as well.
Any certain things I need to look for extra?
So what I like parents to do is to kind of sneak into his room maybe 2 hours after he goes to bed and just record like a 5-10 minute video of him sleeping. That shows me a lot. Like if I'm able to see what position he's sleeping in, see what the mouth is doing, see how good job, see how many times he tosses and turns in that 10-minute window. That is some valuable information. Also, getting him to practice that suction swallow. So just a little bit of water. Start with water, not solids. So tongue up on the spot with the water. Suction the water between the tongue and the palate and swallow like he just demonstrated for me. That's a good place. And And I'll send this to you. I'll send you the report and just a summary of everything we talked about. And then the things I want him to start on right now, day one. So posture, sitting up nice and tall, thinking about where his tongue is. Where's my tongue right now? Just being that body awareness is a great place to start. And then I'll come up with a treatment plan, the different phases of therapy, which after he sees Dr. Austin, it could include a frenectomy, which we'll discuss if that is the case. But I'll develop the phases of therapy, which of course could change depending on what we see, how he's doing. And then again, it's a lot of at-home activities. So it's something you guys have to be willing to incorporate daily into your routine. Yeah. So at his first therapy appointment, I'll start him on his exercise routines. But again, now just work on overall body posture, getting him to be thinking about where is his tongue, what is my tongue doing, and then maybe starting that suction and swallow with just a little bit of water, just so he's used to doing something at home. Okay. And then you did wonderful today. Do you want to come back and see me and work with me? Do you see what's all around us, these superheroes? Mm-hmm. Well, guess what you're going to be doing? You're going to be doing superhero training, because we are building control. We're building strength. You're going to have your tongue's going to have so many muscles you didn't even know it had. Is that awesome? And you're going to be breathing better, sleeping better, which is so important for superhero strength. So I hope you enjoyed that video and found it informative. And if any of the things we talked about made you think of your own child, please don't hesitate to give us a call here at McMurphy Pediatric Dentistry, and we can schedule their functionality assessment and see if we can help them develop their airway. Thanks for watching this video, and I'll see you next time.